Hello, everybody. My name is Martin Dichgans. I'm a neurologist working at LMU Munich. I'm the president of the European Stroke Organization, and I'm here with Else Sandset. Else.
Hi, Martin. Pleasure to see you this morning. I'm Else Sandset. I'm a stroke neurologist working at the Oslo University Hospital in the stroke unit, and I'm also the Secretary General of the European Stroke Organization.
So great to be with you here. Let me just tell you, ESO's mission is to reduce the burden of stroke in Europe, and we do this through our ESO guidelines, our annual ESO conferences and ESO educational efforts, and also through implementation of the Stroke Action Plan. Well, we did not expect that we would be at this point again where many European countries are going into lockdown, where hospitals are reaching capacity and the number of COVID-19 cases are continuing to rise. You might be aware that the WHO previously released its list of 10 global health issues to track in 2021. Most are related to COVID-19. However, the WHO also highlighted the continued need to prevent and treat non-communicable diseases. Else, you're seeing stroke patients at your stroke unit almost every day. How did the COVID-19 pandemic affect stroke care in your daily practice over the last year?
I think initially we saw a decrease in the number of admissions, which was quite worrying for stroke. We were quite worried, especially people with minor and stroke and TIA were staying at home rather than coming to the hospital. I think last year as well, we didn't know as much about COVID. We didn't have enough protective equipment everywhere. So it was a very uncertain situation where we didn't know if our hospitals would be overloaded. I think now, 1 year later, we are a lot more comfortable in this, what I would say, the new normal. Our admissions for stroke patients has normalized, and we have protective gear. I just got my second vaccine, so I'm very happy about that. So the situation has changed over the last year. For us, we've also been we've had to increase the number of beds in our unit, where we admitted the general non-COVID internal medicine patients. And this, we're just back to normal this week, and the third wave is tapering off in Norway, we hope. So hopefully we are now going into more positive months, at least in Norway with the summer.
Well, that's all very interesting. What would you consider the main lesson for stroke neurologists from the current pandemic, Else?
I think for me personally, and I think in general, for a lot of stroke neurologists, I think it's very much highlighted how specialized our field has become. We are dealing with one of the most time-critical conditions in medicine, and the use of advanced imaging, our treatment options for our patients, it's not something that just anyone can step in and take over. So ensuring that we have adequate stroke teams is one of the most important lessons that I have learned from this pandemic. And I think we need, both as ESO, as a community, and as stroke physicians and neurologists, we need to stand up for our patients to ensure that we provide adequate care, also in difficult situations.
I completely agree. And just following up on this, what would you consider the main lesson for healthcare providers in terms of preparing for future pandemics, based on what you've just told us?
So with specific focus on stroke care, I think what we did quite early on last year was we challenged ourselves in thinking, what is good enough care for our patients? How can we provide good enough care? We are so used to striving towards gold standard, but when gold standard, perhaps due to overload of hospitals and so on, is not possible, how can we give good enough, so excellent care to our patients, but not perhaps gold standard? And I think for us, defining that as a team, it gave us a sense of security that we as a team knew that we were providing good care for our patients, even in difficult situations. And I think this for healthcare providers is something that in crisis situation, you might need to reduce the standards slightly, but you need to have it as high as possible in order to give the adequate care that is needed.
Yeah, I mean, obviously, maintaining a high level of care, quality of care for our stroke patients is highest priority. But we've also seen several research labs that had to close and go into lockdown, as you're aware. What does the current pandemic mean for stroke research?
I think for stroke, there are two sides of this. One is for stroke research in general, and one is for stroke researchers. I think the first, of course, a lot of projects have been halted. I think halting projects might also lead to an early closure of projects, and perhaps we are not getting the evidence that we would like and getting the progress that we would like to ensure that we improve both our understanding of stroke and our treatment of stroke. The second aspect is for stroke researchers, and I think especially I focus on junior to mid-career researchers who are now, a lot of people are in home office, you are not having that daily exchange perhaps with your supervisors and the more senior colleagues, or the informal chats where you get advice on your papers or projects. And even more important, we are not getting, people are not, it's not able for people to go to labs overseas or in other countries. So visiting fellowships have been halted. And I think this is, for all of us who have done that in our career, I think this is such an important aspect of career progression, and also to gain knowledge that you bring back and confidence back to your own lab and your own environment. And I think additionally, having the homeschool for children, daycare being closed, the boundaries between what is work and what is normal life is very much getting a bit blurred, and I think it's all tiring us a bit out. So trying to balance these things are important, but I think it's definitely having the pandemic is definitely having an impact on stroke research, and we need to ensure that we cater for all the needs. So we are not our progression is not halted too much.
Yeah, I couldn't agree more. And we've made the same experience here in Munich at our stroke research center. So if I may, another question to you. ESO had to turn 2 of its conferences into virtual meetings, and including ESO 2020, so this year's major conference. Could you give us an idea of what to expect in terms of new elements and formats at ESO 2021?
Yeah, Martin, I think there's some great aspects of having a virtual conference. I'm looking much forward to some excellent live discussions on both the most recent evidence and the controversies. I also think one of the benefits of a virtual conference is that we are not overloaded with meetings during the conference. So we have more time to actually go and listen to the talks, actually take part in the discussions. So for me, that is a positive thing of the virtual, because we are not pressed with meeting, because we are now meeting in one location where we have the opportunity to meet. So these are positive things of the conference. I think it's important that even though it's virtual, we need to prioritize it. We need to block our calendars. We need to get our bosses to say we will have low activity during this conference. Which perhaps enables people who normally not go to conferences abroad, they can participate now from their office. And I think making ESOC an event also in the different departments, it's important, and it's important both for inspiration and also getting the newest evidence into your departments. There are positive things with the virtual conference.
I completely agree. How would you envision societies like the European Stroke Organization should run future conferences once the current pandemic is over, based on our experiences from last and this year?
Even though, as I said, I'm quite positive to the virtual concept, I think it will never replace the fact that we are meeting. I think one of the positive things, or one of the things I really love about going to for example, ESOC, is you come into an environment where you meet people who are they have the same interest, the same passion, and it's for stroke and stroke research. We meet people from all around the world who encounter the same challenges in clinical practice, and a virtual concept can never replace the fact that you meet this community. And I think for many projects, many research projects, many large clinical trials, their initial starting phase has been over a coffee at ESOC or over a drink in the evening. And this is such an important part of our community that can never be replaced. So I look forward to being able to meet my friends and colleagues from around the world again. But I think we also have that we'll always have a virtual part of meetings in the future. I think some of the good things about virtual is also you get people, you enable people to ask questions who would not necessarily want to stand up and ask a question in a large plenary hall. So some of those aspects I think we will bring into the future meetings. If we will have meetings with 6,000 participants again, I don't know, but I will definitely have in-person meetings in the future, and I'm looking very much forward to that.
Yeah, and so do I, honestly. As you know, ESO has made good use of the last 12 months and worked hard on promoting the development of new guidelines, in particular, guidelines for stroke care. Can you tell us a little bit about this?
Well, ESO has now, we have many guidelines in the pipeline, and I think one of the positive things about the ESO guidelines is that we have, instead of making large guidelines that cover all of ischemic stroke care or all of intracerebral hemorrhage care, we have chosen more specific topics. For example, the one I have chaired on blood pressure management in the acute phase. I mean, it's a very small topic in a way, but it's a problem that people encounter in their clinical practice. So a lot of our ESO guidelines are very geared to be very clinically relevant, covering problems that you or challenges you encounter in your daily clinical practice. And we combine evidence-based recommendations with expert consensus statements in a way where we also perhaps cover the more questions that are not necessarily covered completely by large clinical trials, but we avail of the evidence that is available and we make recommendations or consensus statements that we hope will guide the clinical practice. So I'm looking forward to 2021 full of evidence-based recommendations from ESO, and I really hope they are well received by the stroke community.
I know you have been working almost non-stop over the last 12 months, devoting much of your time for our society. Is there anything else you would like to say or share with our audience?
I think even though we haven't been able to meet up in the past 12 months, I think ESO for me has been even more important than ever. Having the sense of a strong international community, being able to liaise with colleagues regarding, for example, what is good enough stroke care in a pandemic, has given me a sense of security, and I think it's been more important than ever. So again, I can't wait to meet everyone when this is over, but until then I will enjoy my Zoom meetings and talking to my friends and colleagues over email and WhatsApp and all other virtual communication channels.
Well, thank you so much, Else. It has been a real pleasure chatting with you here, and also looking forward to ESO 2021. I really look forward to this meeting. Hope that we meet in person soon, and hope that we also will be able to meet with the larger ESO community in the very near future. Thanks, Else.
Absolutely. Thank you, Martin, for a great chat.